today?
Today I am joined by Dr. Tam, Dr. Howard New, Carla Qualtrough in person here in Ottawa today, our Minister of Employment, et évidemment le président.
And of course, the President of the Treasury Board, Jean-Yves Lucot.
As usual, first from Dr. Tam. Dr. Tam, please.
Good afternoon, bonjour. I'll start with the latest numbers on COVID-19 in Canada. There are now 94,070 confirmed cases, including 7,652 deaths, and 52,114, or 55%, have now recovered. Labs across Canada has tested over 1,824,000 people for COVID-19 to date, with about 5% of these testing positive overall. And over the past week, we have been testing an average of close to 29,000 people daily. As I said in yesterday's presentation on modeling, although people of any age can develop COVID-19, some people are at higher risk for hospitalization and death, such as older adults and people with chronic medical or immune-compromising health conditions. In particular, seniors living in long-term care homes have borne the disproportionate impacts and severe outcomes of COVID-19. Prevention and control of COVID-19 in this population is crucial for minimizing morbidity and mortality due to COVID-19. However, we cannot ignore the direct and indirect impact that COVID-19 has had on young people. While the number of cases among children and youth has remained low, young people have experienced major disruptions in their lives, whether due to illness in the family, closure of schools and recreation programs, or missing social connections and celebrating special events resulting from physical distancing measures. In addition, COVID-19 is exacerbating existing inequalities, making life more challenging for many Canadians. While children and youth are resilient, we must take care to support their physical and mental wellness at this time. We can do this by talking openly with children and youth, answering their questions, calming their fears, and engaging in healthy activities to nurture and support their emotional health. It is also important to keep up to date with routine vaccinations and to maintain regular health visits. Speak to your healthcare provider to learn about the options available, including virtual appointments and other precautions in place to ensure your health needs can be met safely. Finally, with the end of the school year upon us, I want to congratulate all those who are graduating this year. While it may not be the celebration that you envisaged, this does not diminish your accomplishments. You have worked hard in your academic and extracurricular pursuits, while demonstrating great poise in adapting to the disruptions that COVID-19 has wrought. The many ways you have come together to support your families and communities as we learn to live with COVID-19 have inspired all of us. We are all together apart, so I'm really proud of you. Congratulations. Thank you. Merci.
Thank you very much, Dr. Tam. Et maintenant, je donne la parole à Dr. Howard New.
Dr. Howard New has the floor. Dr. New, thank you. Good afternoon. I will start with the latest numbers on COVID-19 in Canada. There are now 94,070 confirmed cases, including 7,652 deaths and 52,114, or 55%, have now recovered. Labs across Canada have tested over 1,824,000 people for COVID-19 to date, with about 5% of these testing positive overall. Over the past week, we have been testing an average of close to 29,000 people daily. As we said in yesterday's presentation on modeling, although people of any age can develop COVID-19, some people are at higher risk for hospitalization and death, such as older adults and people with chronic medical or immune-compromising health conditions. In particular, seniors living in long-term care homes have borne the disproportionate impacts and severe outcomes of COVID-19. Prevention and control of COVID-19 in this population is crucial for minimizing morbidity and mortality due to COVID-19. and indirect impacts that COVID-19 has had on young people. While the number of cases among children and youth has remained low, young people have experienced major disruptions in their lives, whether due to illness in the family, closure of school and recreation programs, or missing social connections and celebrating special events resulting from physical distancing measures. In addition, COVID-19 is exacerbating existing inequalities, making life more challenging for many Canadians. While children and youth are resilient, we must take care to support their physical and mental wellness at this time. We can do this by talking openly with children and youth, answering their questions, calming their fears, and engaging in healthy activities to nurture and support. It is also important to keep up to date with routine vaccinations and to maintain regular health visits. Please speak to your healthcare provider to learn about the options available, including virtual appointments and other precautions in place to ensure your health needs can be met safely. Finally, with the end of the school year upon us, I want to congratulate all those who are graduating this year. While it might not be the celebration that you had envisaged, this does not diminish your accomplishments. You have worked hard in your academic and extracurricular pursuits while demonstrating great poise in adapting to the disruptions that COVID-19 has wrought. The many ways you have come together to support your families and communities as we learn to live with COVID-19 have inspired all of us. We are all together, apart, proud of you. Congratulations. Thank you. Merci. Thank you, Dr. New.
Here today in person here with us in Ottawa from Minister Carla Qualtrough, who has some important information to share with us. Please, Carla.
Thank you, Deputy Prime Minister, and hello everyone in person. As many of you know, this is National Accessibility Week. We celebrate the contributions that Canadians with disabilities make to our communities every day and reflect on the ways that we can take action toward a more inclusive and accessible Canada. We know this pandemic has deeply affected the lives and health of all Canadians and disproportionately affected Canadians with disabilities in particular. I think of the significant costs persons with disabilities have incurred to safely get food, medication, and other basic necessities. We also know that there are additional costs for delivery services and private transportation. Il se peut aussi que les travailleurs de soutien pour les
support workers for these people may not be available or may have to be paid for privately because of a lack of supply.
Prime Minister announced a one-time payment of $600 for persons with disabilities to address these expenses. This payment will go to existing disability tax credit certificate holders, which includes parents with children or dependents with disabilities, seniors, veterans, and many other Canadians that we know have costs associated with severe and prolonged disabilities. Il n'est pas nécessaire de présenter une demande pour
It is not necessary to apply for this amount.
$38 million investment will benefit around 1.25 million Canadians. We also recognize that persons with disabilities are at a higher risk of job loss during economic downturns, which is why we've established a national workplace accessibility stream, and we are investing $15 million in 2020 to 2021. In addition, we're investing $1.18 million in projects through the Accessible Technology Program. I'd also like to acknowledge the members of the COVID-19 Disability Advisory Group that have been providing important advice in the lived experiences of Canadians with disabilities and helped shape today's announcement. I thank them for their continued work. Je suis certaine que ces mesures
I'm certain that these measures will be of great help to all Canadians who are living with disabilities throughout this country. It's a win-win for everyone if every Canadian can play an equal role in our economy and our society.
I'd like to address today's job numbers. Since the beginning of this crisis, we've been focused on providing Canadians with the support they need as we work together to contain the spread of the virus and to keep Canadians safe. As the Prime Minister mentioned earlier today, we know that roughly 1.2 million Canadians who were accessing the CERB no longer need this help. and today's job numbers reflect some positive progress in terms of people returning to the workforce. While this is indeed encouraging, there's still a long way to go. Many Canadians continue to face real challenges during these times, and it's for that reason that I want to reiterate that our government will continue to be there for Canadians. Nous traverserons cette période difficile.
We will get through this tough period together.
Okay, thank you very much, Carla. Et maintenant, je donne la parole au...
And now, the President of the Treasury Board, Jean-Yves Duclos. Thank you, Christia, and good afternoon, everyone. This morning, we have some good news. We'll focus on three. First, what Carla just described, which is a support up to $600 for people living with disabilities throughout this country, certainly in Quebec. The COVID-19 crisis has increased the barriers for these individuals. Second piece of good news is the support for provinces and territories, including Quebec. Support that will be of assistance to the provinces who have to take on this heavy burden in the current situation in order to supply PPE for daycare services, support, also support for seniors in health and economic difficulty, and also the provision of sick leave so that individuals do not have to choose between protecting their health and protecting their livelihoods. And finally, some good economic news from my colleague Carla. 10% of jobs lost between February and April were recovered between April and May. That represents 30% of job losses that have come back between April and May. This is in contrast with February and April. Unemployment was at 17%. We're now at 13.7%, which is the national average. This is for Quebec nationally, but the economists understand why. Economists know that when it's a period of recovery, as you are emerging from an economic crisis, it is normal that the labor force increases because people want to go back to work, so they are seeking new work, and that explains this slight increase in unemployment, despite the fact that the number of unemployed individuals has decreased. As my colleague Carla has said, the context of significant measures that we've taken over the last few weeks is particularly significant. The CERB, Canadian Emergency Response Benefit, we are now moving from that to returns to work, and also the wage subsidies had major impact in Quebec. And I would add also that there is a very interesting situation for youth, specifically young people who want to continue with their studies in the fall are facing a difficult situation there. Unemployment rate was at 14% about a year ago and stands at 40% for these students who want to go back to school in September. So you can understand why the student response benefit is important to support their personal finances so they can go back to school at the end of the summer. We've also created over 150,000 new job opportunities, apprenticeship opportunities, which will help young people get the support they need to go back to school, university, college, also the help they need in order to work experience over the coming month. Thank you, Christia. Thank you, Jean-Yves, says Christia. We are prepared to answer your questions.
With 3 questions on the phone and then turn to the room. 1 question, 1 follow-up. Operator?
Thank you. Merci. Our first question, notre première question nous vient de Lina Dib avec la presse canadienne. Please go ahead. À vous la parole.
Question, Lina Dib, Presse Canadienne. Question. My question is for you, Mr. Duclos, and also for Ms. Freeland. This $14 billion to be transferred to the provinces seems attached to conditions. I would like to know how provinces took to that. Do you really think you'll be able to agree with the provinces, given the fact that these are provincial areas of jurisdiction, mainly health in this case? Answer. Thank you for your question, Lina. I'll attempt to answer, and perhaps Jean-Yves will have a few words as well. We discussed this very matter yesterday with the Prime Minister, And during our conversation a week ago, obviously, the federal government's objective is to help Canadians as the economy reopens. And we can see, given the figures we've received today, that this reopening has started and it's a good thing. But we understand that there remains much to be done to be sure that this reopening is possible, that this economic recovery takes place, that protect the health care of all workers, Canadian workers. We also understand, and I speak as a mother here, there need to be certain things in place. Childcare, daycare, and it's also important to, specifically with respect to public transit, we understand that these things are within provincial areas of jurisdiction. But I have to say, Lena, that when I speak to Canadians, for Canadians, the thing that matters is not whose jurisdiction. What matters is to achieve success in our fight against the coronavirus and to have a strong economy. We're pleased that we now have this opportunity to work in close cooperation with the provinces. $14 billion is a significant amount. And of course, it is important for the federal government to be sure that by working through the provinces, we can guarantee the right conditions, the necessary conditions are in place for all Canadians throughout the country.
The important thing from our perspective is to ensure we have the conditions here in Canada for a safe and effective restart of the economy. The jobs numbers that Carla and Jean-Yves have just spoken about show us that that restart is beginning. And I am so grateful to all the Canadian workers, to all the Canadian businesses who are participating in it. We understand that we have to make sure that people have the things that they need to make that safe restart healthy, to make it safe, and to make it possible. That includes things like ensuring there is enough PPE, ensuring we are effectively testing and tracing, ensuring, and here I'm speaking as a mother, ensuring that there is childcare available, ensuring that our municipalities are supported because they provide the public transit, ensuring that people have sick leave so that if they are feeling unwell, they do the healthy thing and don't go to work that day. So we know that this is what Canadians, whatever province or territory they live in, really need. Understand that these are areas that are in provincial jurisdiction, but we know that the economy is in a very difficult spot right now. And so the federal government is stepping up and saying, we are going to contribute $14 billion to this essential effort. Now, we also realize that the way to do this successfully is through a collaborative conversation with the provinces. That is, we had a conversation yesterday about this. We spoke about these issues also the week before. And now what we really want to do is metaphorically roll up our sleeves, get to work with the provinces, talk with them about the areas that they think are necessary for a safe restart, put forward our own perspective, and really ensure that together we can give Canadians the support they need for our economy to get back to work safely. Jean-Yves, est-ce que tu as quelque chose à ajouter?
Jean-Yves, did you have anything to add? Jean-Yves Duclos, yes. Perhaps from a Quebec perspective, Mr. Trudeau are in close communications with their counterparts and have been in communications with the provinces. They know what the provinces are concerned about. Even though all of this is a provincial area of jurisdiction, the federal government does have a responsibility to help the provinces in the emergency situation we find ourselves in today. In Quebec specifically, some private daycare has in some way been weakened in some areas. I've had this discussion with some stakeholders in this field, although the Canadian government understands fully well that it's a Quebec government responsibility. We want to be able to help the government of Quebec act in this period. Same thing for seniors, same thing with personal protective equipment, testing, tracing. All that requires significant resources. The provinces are being pressured financially in that regard. The issue of sick leave, Premier Legault mentioned that it would be a very heavy burden if it were only on the provinces. And so Madam Freeland, all premiers have worked very hard in order to work collaboratively to achieve that end. Question? Thank you. So if I understand correctly, because this is a pandemic, you do not think there will not be any quarreling regarding jurisdiction between Quebec and Ottawa. I'd like to know also how much of that money will be going to municipalities. You were talking about public transit. Cities are also facing major pressures. Is there an amount that is earmarked for municipalities in that regard? Answer, Madam Freeland. That's an excellent question, Lena. I fully agree with you that the cities and municipalities have major needs, and we are absolutely in agreement with the fact that cities and municipalities are essential to a restart. The federal government is prepared to make its contribution, and that is what the Prime Minister referred to today. Now, referring to specifically to the amount set aside for each category, these are discussions that have to take place with the provinces and territories. We believe that a collaborative approach is critical, and we need to speak to the provinces and the municipalities to be sure that an economic restart is healthy and will work for Canadians. Thank you. Next question.
Prochaine question is from Mia Robson with the Canadian Press. Please go ahead. À vous la parole.
Yeah, this is probably for Minister Freeland. If you're still working with the provinces, you're sort of saying you're metaphorically rolling up your sleeves now to figure out the details of this program. You can't tell us how much is earmarked for municipalities specifically. How did you arrive at this $14 billion figure, and how is it going to be dispersed to the provinces? Have you figured out even any of those details, how much each province would get?
Well, let me say a couple of things. If you are going to have a truly collaborative approach and a true discussion, you can't go into it saying, and by the way, this is going to be exactly what the end result is. Since we really believe in having a collaborative approach with the provinces, and we understand Canada is a huge country. The needs differ very, very much from coast to coast to coast. We really are approaching this by saying to the provinces and territories, we understand that a safe restart is essential and that it is expensive. We said from the beginning of this crisis, we are not going to quibble about federal provincial responsibilities. We are going to be there to support Canadians across the country. And that is what we are doing here. In terms of the Prime Minister specifically saying, and we're going to put $14 billion on the table, look, having been through a few negotiations myself, I really believe that someone has to get the ball rolling. And it's important to start putting some specific offers on the table. That's what the federal government did last night in the conversation with the premiers, and that's what the Prime Minister has shared with Canadians today. One other thing that I would like to really underscore is what we are talking about is the safe restart right now. So this is not a long-term plan. This is for ensuring a safe restart over the next 6 to 8 months. And I think it's important for Canadians to understand that that's the time frame that we're focused on. Thanks.
Follow up?
Yeah, I'm also curious from Minister Qualtrough. Labor groups, business groups, economists, they're asking for sort of an overhaul of the emergency response benefit program and maybe rethinking how EI works. So the jobs gains are continued. Are you considering any changes to either of those programs? And if yes, what are they?
Well, thank you. It's important to understand that when we put in place the CERB, we did so because we asked Canadians to stay home and be safe and not work. And as we look into the months coming, as the Deputy Prime Minister said, we've got a different goal in mind. People need to get back to work safely. And so as we look at the extension to the wage subsidy, as we look at Canadians having exhausted their 16 weeks of CERB, as we look at potentially transitioning EI eligible Canadians back into the EI system, of course, conversations are happening within cabinet, with the provinces and territories, with labor, with business associations on how best to structure our support moving forward. On the one hand, we know Canadians will continue to need support. While optimistic, what the job numbers showed today is that 490,000 people entered the labor force and 290,000 new jobs were created. Certainly better than job loss, but the unemployment rate is still up. So our thinking moving forward is, how do we balance a need to continue to support workers while not disincentivizing work? And absolutely, those conversations are happening right now.
Thank you, Minister. Operator, next question, please.
Thank you. Merci. Our next question, notre prochaine question, is from Mélanie Marquis avec La Presse. Please go ahead. À vous la parole.
Thank you very much. My question is for Ms. Freeland. To get back to my colleague Lena's question about municipality play and major pressures on them right now, to be clear, the conditions you're asking of the provinces is that they set aside a percentage of the money that you will be providing for certain aspects for municipalities. Is that part of the conditions you're referring to? Answer. Thank you for your question. I would prefer not to use the word demand or demande that you used in French. What we need is to engage in a collaborative conversation with the provinces and territories, and that's precisely what we're trying to do. Now, with respect to municipalities, to us, that is one of the main objectives of this agreement, of this federal initiative. We absolutely understand, on the one hand, the reality that municipalities are facing. They are essential to the Canadian economy, and they are especially, all the more so, essential given our restart. On the other hand, we fully understand the fiscal position municipalities find themselves in. So yes, an important aspect of this conversation will be the support of municipalities. And the federal government has made a proposal. To us, it will be important to have these discussions, to have these conversations with the provinces and territories, and I hope we will also see support from the municipalities. Follow up. Yes, a question for Madam Freeland. Earlier, Prime Minister Trudeau, in his speech, said that the situation varies from one province to the next, and our plan will take this into consideration. What does that mean in terms of a breakdown of these amounts? Will it be based on demographics? Will it be based on the way in which the crisis specifically affected a particular province? Ontario and Quebec, for instance, were hard hit. Will that be part of the calculus to determine how much each province will receive? Answer. As always, I fully agree with the Prime Minister. And one thing that we understand clearly at the federal level is that our vast country is very diverse, and we understand that the situation in Nova Scotia is quite different than it is in BC and quite different from the situation in Quebec. So in the context of our discussions with the provinces and territories on this agreement, we said yesterday, and we will continue to say in the future, that it is really very important to get a good grasp of the diversity of our country, and that's what we will do.
Mac?
From CTV News, I'd like to start off by asking about Hong Kong. Prime Minister Boris Johnson in the UK has put a pathway forward to get 2.5 million citizens of Hong Kong and potential British citizenship quickly. This seems like a country that is in line with Canadian values. Many of the people who would be leaving Hong Kong right now are fighting for democratic rights. They also, many of them speak English and are highly educated. Why is Canada not putting in place an immigration system to encourage these people who would fit in Canada quite nicely, a way to come here in an easier fashion like the UK is?
Well, thank you very much for the question, Mackenzie. And let me start by saying there are already roughly 300,000 people who currently live in Hong Kong who can come to Canada this afternoon. These are people who are Canadian citizens. And what I would like to say to all of those Canadian citizens who live in Hong Kong, you are very, very welcome to come home anytime you like. You are Canadian. We would love to have you back. I would encourage everyone also to register with the Canadian consulate in Hong Kong. Be sure all your travel documents are up to date. The Hong Kong Canadian community is such a valued and important community in our country. I think all of us are so grateful to the contributions that community has made. So Canada has a particular interest in Hong Kong, and we believe that the Canadians in Hong Kong are the largest single expat community there, certainly one of the largest. And that is the group of people in Hong Kong we're paying particular attention to right now. And as I said, all of you are very, very welcome to come home anytime.
On another note, my colleague Laura Stone from the Globe and Mail just tweeted that Doug Ford has asked your government for $23 billion to fight COVID, which is substantially less than the 14 you're offering all of the provinces. Can you confirm that Premier Ford has asked for that? And is the $14 billion, I should say, is that a starting point for a negotiation with the provinces, or is that the final offer and that's what the provinces will be receiving?
Look, $23 billion just for Ontario is indeed more than $14 billion for the whole country. I would point out that $14 billion is a lot of money. And our government is very clear that now is not the time to quibble about federal provincial jurisdiction. And that has been our approach throughout this crisis. And we have come forward on our own and said, we understand the burden provinces and municipalities are facing. And the Prime Minister this morning and yesterday in conversation with the premiers put $14 billion on the table. I think that all Canadians in all walks of life will see that as a very generous way to start a conversation about how we can work together, provinces, municipalities, the federal government, to guarantee a safe restart for all Canadians. And I do think it's important to emphasize that this is a program focused on a very specific period of time. It's about the safe restart that we are facing today. It is about the next 6 to 8 months. And we think it's really appropriate to be focused on that right now because none of us has a crystal ball. 3 months ago, none of us could have imagined, I think, that we would be where we are today. And so we think the smart thing to do is to look at what is right ahead of us, that is having a safe restart for Canadians. And the federal government is saying, we understand that it's expensive, and we are here with $14 billion in hand to work together with the provinces and territories and very much the municipalities on that. And I'll just say one final thing, which is, when it comes to the safe restart in the Canadian economy overall, the federal government has also put tremendously powerful and expensive economic programs in place. We've spoken earlier today about the CERB. We have spoken also about the wage subsidy. I am so proud of those programs. And with the job numbers that Carla and Jean-Yves have been talking about, we have seen that those programs are supporting Canadians through a very difficult time and crucially helping Canadians get back to work. Now, they cost a lot of money. I personally do not begrudge a single penny that goes into them because they're helping us get through this and get back to work. That is a really major and probably foundational federal contribution to us getting through this difficult time.
Are you willing to give them more money? Because the $23 billion, as you said, is considerably more than 14.
One question, one follow-up. Ashley.
Good afternoon, Ashley Burke, CBC News. Dr. Tam, given the number of people that are protesting in the United States right now and also here in Canada, are you expecting to see a rise in COVID-19 cases in the coming weeks? And as well, what could that mean for reopening the Canada and U.S. border?
Maybe I'll take the first. So I think all public health officials will be watching this very carefully. I think we are emphasizing a safe process, observing the public health measures, including as much as you can physical distancing, wear a mask if you don't think you can control the 2-meter environment, having hand sanitizers or access to hand hygiene. Of course, don't show up if you're sick because I think that is important to protect everybody else around who's supporting the same cause. And I think many public health officers have advised that, to monitor your own symptoms in the days following. If you've been participating in any kind of gathering. I think, it's difficult to say, actually, but it is something that's worth looking at. As we said before, outdoor spaces are generally lower risk than indoors, for example. There are also virtual ways of which people can make their voices heard and alternative means to speak out for what you believe in. And so I think look at all options to voice your opinions and your rights. But I do think that local public health is watching carefully because we do know that is the sort of, I would say, close contacts and close environments and crowds are some of the at-risk settings. So take care of yourselves.
And Ashley, on the border question, if I may, I'd just like to start by saying I think that we need to be careful not to think of the border as being closed today. Really critically, the Canada-US border is currently absolutely open to essential travel. And one of the really successful aspects of the border agreement that we've reached with the United States and the decisions we've taken about the border here in Canada is that essential travel, including essential trade, is happening. We're seeing, for example, the auto industry restarting, and trade across the border for that industry continues to happen. That is so important, continuing unimpeded. Now, when it comes to non-essential travel to protect the health of Canadians and indeed for our neighbors to protect their own health, we have imposed restrictions on non-essential travel. And those restrictions are there to keep Canadians healthy and safe. We are constantly monitoring the situation at the Canada-US border, and our priority is always going to be to take care of the health and safety of Canadians.
The labor statistics today showed that they disproportionately affected women as the economy reopens, and in part it might be as well because of daycares being shut down. But do you have a concern overall that this could be a systemic issue in the long run for women going back to work?
Thank you. Really important question. We saw today that 29% of the jobs that were created last month were for women. And obviously that doesn't match that 50% of our population are women. Absolutely, we need to understand the impact, the disproportionate impact that this pandemic has had on women, whether it be increased childcare responsibilities, precarious work to begin with, undervalued work to begin with. So we absolutely know as a government that a successful recovery from this will necessarily involve a deliberate focus on supporting women, mothers, as Christia mentioned in particular, through this.
Yeah, and I would just add, I think that is an excellent question, and it is a preoccupation of all of us in government. I think it would be fair, as some economists say, to describe the recession we are currently experiencing as a she-cession. And we know that we need do people say she-covery? But our government is a feminist government, and the particular nature of this economic crisis is it hits women especially hard. We're focused, therefore, on ensuring that we support women. And that is one reason why a key element of the safe restart that we would like to discuss with the provinces and territories, that we are discussing with the provinces and territories, a key element of that safe restart needs to be childcare. Because for women, for mothers, without childcare, it's impossible for them to go back to work.
Thank you, Deputy Prime Minister. We'll take one last question on the phone. Operator?
Thank you. Merci. Our next question is from Élie Bergeron avec Agence QMI. Please go ahead. À vous la parole.
Oui, bonjour.
Yes, I'm not sure who should answer this question, perhaps Minister Duclos. Regarding the discussion for the extension of the Canadian Forces mission in long-term care homes in Quebec, could you tell us a little bit about that? The deadline is coming up, and there's still no agreement. Can you tell us where we're at and what the problem is in these discussions? Answer. The short answer to that is that the discussions are going very well, and the longer answer to that is that they're going well because everyone, including the forces members, understand the very vulnerable conditions that long-term care homes in Quebec are facing, and many of these CHSLDs, certainly some particular care homes were identified by Quebec, and these homes have seen great improvements over the last couple of weeks in Quebec. Of course, it's due to the work of the existing staff, but everyone agrees in the current context that it is partly due to Canadian forces who have collaboratively and respectfully supported the work that was done. What is clear is that Canadian Armed Forces will continue to be there to support seniors in these long-term care homes in Quebec. There are some movement. There is some movement or some improvement in the sense that there were some of these homes that were considered to be in the yellow or red zone and are now moving towards the green zone. So there's a potential for moving some of these resources, and discussions are ongoing over the coming days and coming weeks as to how the armed forces can be of support. All of that is happening in a very collaborative, very respectful way, always recognizing the difficult conditions in these centers. In many cases, the conditions have improved greatly over the last few weeks, but there still remains some work that needs to be done. Follow up?
Oui, aussi.
Regarding the CERB, the CRA said there were 190,000 reimbursements for people who had received too much money or for amounts that should not have been granted for the emergency benefit. Were these amounts or some of these amounts refunded voluntarily by Canadians through their account, my account? Do we know how many cases of this exist, and what's the proportion of cases does that represent? Answer: what we know is that the CRA is a very solid agency. Madame Le Boutillier, the minister, repeats it. It's an agency that has a lot of information on Canadians, but also has highly qualified, dedicated staff that is tracing back any case of fraud that could occur. They're already doing that in normal circumstances, even all the more so in this crisis. The point was that the CERB had to be implemented very quickly, but Madame Le Boutillier, the minister, and all government members, the prime minister, have all said repeatedly that yes, this benefit would be vigorous, but also rigorous in a sense. Both of these factors had to enter into play because in the coming weeks, if there are any examples of errors and sometimes, unfortunately, some examples of fraud, well, this rigorous approach will help. The CRA will address these issues and correct them. Madam Qualtrough, did you have anything to add? Response. Answer: yes, absolutely. There are some people who applied both for the CERB and EI at first, as I said, so there was a doubling up of payments. I think that represents 200,000 people. The CRA, Canada Revenue Agency, is working very closely with Canadians to reclaim some of these doubled up payments, but that's no longer happening. The change has taken place in the system and it won't recur. Of course, as my colleague said, there are situations, there can be cases of fraud, not many of them. There aren't that many of them. We have very rigorous integrity mechanisms post-payment that enter into play, and we're quite confident that all of those who were overpaid will have to repay the extra amount. Thank you, Minister.